Hello, today I'm going to give you some tips for your physical assessment. I don't have the physical assessment validation sheet in front of me, so if you have specific questions about that, you can ask me and I can try to help you, or you can ask your professor. This is just how I like to do my physical assessment in clinical, how I've kind of learned my routine. So for clinical, I like to either chart in the room while I'm doing the assessment, so I make sure I don't forget anything while I'm still like getting my routine down, or I have a sheet like this. That has like everything, all the different systems on it. So sometimes I'll take this just so I make sure I don't forget anything. This one's pretty in-depth. You can find different ones, like you can find ortho ones or cardiac or just different for whatever patient you have. So I'd recommend just finding your own materials if you really need help with that, or just coming up with your own system of doing it. So first you're gonna make sure that you introduce yourself to the patient, confirm their name and date of birth, check their orientation status, level of consciousness. You can do that by asking simple questions like, what is your name and date of birth? Do you know where you are right now? What month is it? What year is it? Who is the president? That kind of stuff. Sometimes you don't want to ask what day it is because in the hospital they can run together, so you don't want to like think that they're confused and they really just thought it was Sunday and it's actually Monday. So then you're going to do vital signs. Those might have already been done by the tech in clinical, or you can go ahead and get them yourself. So you're going to be looking at temperature, pulse, respirations, blood pressure, and pain. And then of course their oxygenation status. For pain, you're going to be asking them on a scale of 1 to 10 if they're learn oriented, and if not, there's other scales that you can use. But I don't think you do that for your validation. So ask on a scale of 1 to 10, and then ask about what kind of pain is it? Does anything help it? Does anything make it go away? Does anything make it worse? Have they had this pain before? Just questions like that, so you kind of can get an idea of maybe what the pain is coming from and how you can help stop it. And then just look at their overall status. Do they look sick? Are they green? Are they yellow? Are they like bright red? Are they really pale? Do they look malnourished? Do they look anxious, sad, angry, happy? Do they look like a healthy weight? And then for a neuro, of course, you're doing your level of consciousness. You're going to be looking at their eyes. Do they wear glasses? Do they use contacts? Are they blind? You'll look at their pupils. Are they equal, round, reactive to light and accommodation? Are they sluggish, brisk, non-reactive to light? And then with their ears, are they hard of hearing, deaf? Do they use a hearing aid? Do they have an implant? Is there any drainage? For neuro, you're also going to check their hand grips, see if they're equal, and then you're going to do your dorsiflexion and plantar flexion and see if that's equal strength there too. Sometimes it's expected for it to be unequal, like if you have an ortho patient and they just had surgery on a knee, of course that foot is not going to be as strong as the other one, but just keep that in mind. And then for neuro, you're also going to do your cranial nerves. I'm not going to go over all that because that's a lot, but just make sure you know that for your validation, however they're doing that this year. And then for cardio, you're going to be looking at their skin. Is their skin pink, pale? Are they kind of blue tinted, yellow, flushed? Are they kind of like cold and sweaty, diaphoretic? You're going to check their radial pulses, their pedal pulses. Make sure you can feel them on both sides. Your carotid, make sure you don't do these at the same time. You do all the other ones at the same time, just not these ones, because you can cut off circulation to their brain and they can pass out. Cap refill, you want to make sure it's less than 3 seconds. Look for JVD, like a bulging neck vein right here. Any edema, is it pitting or non-pitting? And then you're going to want to look at their calves to check for a DVT. So are their calves tender? Do they have pain there? Is it red, swollen, really warm? You're going to look at Holman sign. So I think that's where they like shove their foot down really fast, and if it hurts really bad, that's a sign of a DVT. Their heart rhythm, you'll learn more about that junior year, but if they're on tele, just kind of look at what rhythm they're in. Regular, irregular, do you hear a murmur? Are there extra sounds, S3, S4? Is their heartbeat strong, or is it faint? Is it muffled? Do they have a pacemaker, defibrillator? For respiratory, you're of course going to be counting the respirations. They should be 12 to 20. Is their breathing regular, irregular? Is it labored or unlabored? Is it symmetrical? Lung sounds, are they clear, or do you hear like some wheezes or crackles? That could be fluid in there. Do you see nasal flaring as they're breathing? Is there retractions? Do lung sounds improve with cough and deep breathe? Do they have a cough? Is the cough non-productive? Is it dry, moist, productive? What's the sputum like? You're going to look at the amount, color, and frequency. Are they on oxygen? What's their oxygen at? If they are, what kind are they getting? Is it a nasal cannula, a mask, tent, CPAP, or BiPAP? Are they using their intensivist spirometer? How often? Look at their allergies, of course. You might check their blood glucose if they're diabetic. So that was all that was on my sheet. So this kind of helps me. I use this, I think, for my ortho clinicals. And then, of course, you're going to inspect the abdomen. You're just going to look at it first, see if you see any distension, and then you can listen to all four quadrants for bowel sounds. I forget how many sounds you should hear, like, within a certain amount of time, but to say that they're absent bowel sounds, you have to listen for 5 minutes. So that is very rare. You probably won't see that, and if you do, make sure you listen for 5 minutes, and you're telling the charge nurse or whoever, because that's a big deal. And then you're going to palpate, see if they have any pain or tenderness in their abdomen, ask about their last bowel movement. Is their bladder distended? You're going to assess range of motion in all extremities, arms, legs, and ankles. Do they have any like tingling or numbness in their extremities? You're going to check skin turgor, check for lesions, abrasions, rashes, check for tenderness, lumps, lesions. For neuro, you can also assess their gait if they can walk, so that can tell you a lot. Assess their reflexes, coordination, Glasgow Coma Scale, that's usually in the chart, so you can do that really easy. I think that covered, that's like usually what I do in clinical. I know for the validation it's like this 45-minute long thing, but usually my assessment probably takes like 10 to 20 minutes depending on the patient. If they're a more like complex patient, it takes me a lot longer, but just make sure if you're not sure about something, watch your nurse do it a couple times. I usually like to watch my nurse do an assessment and then I can do it myself, just kind of seeing how they do theirs. But you'll find your own rhythm to it. You'll get used to it. Just make sure you're asking questions, practicing. For the validation, I would recommend practicing like nonstop until you get it right. Break it down into different sections. So practice your vitals and just all the different assessments, like break it down into pieces and practice doing those until you get each section right, and then piece it all together. So practice with a friend in nursing school so they can help you, or have a script and give that to a friend or a family member, and they can be like, oh, you forgot to check for edema or check my mucous membranes or something like that. And even if it's something that they don't know what it means, it's still helpful to have someone calling you out when you miss something. And then when you're doing your validation, just going back and literally saying out loud, like, okay, I did vitals and I listened to heart sounds and lung sounds and I did this, and make sure you go through every single thing. And that will help you not forget anything. So I think that covers everything. Trying to think. I like to listen to podcasts about nursing, so that's kind of helpful for me. Also, there's a lot of YouTube videos I've watched about physical assessments just to give you some tips. I'm not the best person for tips because I am still learning myself. So yeah, I would recommend checking out YouTube. If you guys have any questions, you can always ask me.